The management of dysphagia so far has been based on thickened fluids. Thickened fluids gives us a presence in the throat. It helps to initiate swallowing and to some degree safeguard our airways. However, thickened fluids is not the answer or the whole answer to dysphagia. We believe that we've got to think devices, and the RoseCup is the first step in that direction. It helps us to suck before we swallow, which is the way in which we learned how to swallow safely. Initiates the reflexes, help to safeguard the airways and make swallowing effective. It also helps us with flow control and volume control. However, the RoseCup is not a utopia. It's not a total solution to the swallowing problems. It is a first step, however. To think devices, I believe we've got to think anatomy regions. Lips, cheeks, the back of the throat of the pharynx, nasopharynx, which is the back of the nose, the larynx, which is the voice box, and the esophagus, which is the swallow pipe. The lips, if we test it, should be able to close tightly. Like the air doesn't escape if I poke my cheeks. Stick out the tongue, should be able to move up, down, left and right. Stick it in my cheeks and it should bulge out on both sides. What happens to the postnasal drip? Does it run down and I swallow it down, or does it sit there, blocks the nasal cavity and cause a constant postnasal drip and a clearing of the throat? What happens to the voice? Can I talk properly? Do I clear my throat the whole time? Do I choke when I swallow? What happens to the bolus of food? Does it go down or does it come back up again? We have a couple of devices in the pipeline that will see the light in the next couple of months and years, but we'd like to engage with you. If you see as we roll it out that your patient has got a problem, evaluate the problem. Is the problem that his tongue can't move? Is the problem in his larynx? Is the problem in his esophagus? Is the problem the facial nerve that controls the lips and the cheeks? And we'd like to interact with you so that we've got a partnership in trying to solve the problem. If we can move a little bit forward towards conquering the problem of dysphagia, that might just help those disadvantaged in swallowing.